Thank you for listening to the FND Society podcast. I'm your host, Erica Cotton, coming to you from Chicago. I have an excellent team, including Michael Romeo, our sound and production engineer, coming to us from Australia, and our content curators, Ingrid Hurritzauer from the UK and Chrisma Pretorius from South Africa. We also thank Megan and Robert for all their administrative support. So this episode is an on-site FNDS conference discussion. Guests are Ingrid Hurritzauer from the University of Edinburgh, Chadwick Lane from the University of UT Southwestern, Alex Len, Princess Alexandra Hospital, Chrisma Pretorius from Stellenbosch University, Gabrielle Gilmore, University of Calgary. And what my listeners can't see is that all of these wonderful guests are enjoying themselves by giving very enthusiastic hand gestures for every single one of us. With that, I will turn it over to Alex and Chrisma to discuss day one and the initial training for our listeners.
Thank you. Well, you should ask what our highlights are, I think.
Yeah.
Day one was my highlights so far, I have to say. I'm very much a clinician at heart. I think this is something we need to foster and drive in the society. I think this is a really nice tradition. We have already started with those day one training courses. I have forgotten already what FIRST stands for. What was FIRST?
Foundational.
But it sounded so good at the time.
It was amazing.
I have forgotten, admittedly, what FIRST stands for, but really enjoy the day. I think this is something that needs to be done at every meeting. This is a really great opportunity to get junior doctors, junior allied health, and other interested people on boards, create a common level of understanding about that and really drive good clinical care. So I think this is totally to be done further and hopefully even build up on further with more practical courses that we can do.
As a society, I think this is just a really cool thing. I haven't seen this at many other meetings where there's such an opportunity for such immediate learning before people even start the conference. You just don't see that. I think it's great that FNDS is doing it. I think it's really allowing a lot of growth and training. And
I don't have easy answers for it because it's probably you have the same, like with the different tracks that we have.
Oh, yeah.
Amazing as it is, but then you kind of I always have FOMO, isn't it? So like, should have gone to the other one.
Right? Yes.
I love the opportunity to go to different tracks as the year goes by as well.
Yeah, maybe you could cycle through the years. Yeah.
And Chrisma, you enjoyed the afternoon session?
Yeah, and another important and memorable session focused on self-care and burnout prevention for clinicians working with FND. So while FND work can be deeply rewarding, it also carries unique challenges, as we all know. And Prof. Stone highlighted the emotional intensity of this work and the sense of responsibility clinicians often feel for the patient outcomes. And a key message was that it's normal to struggle at times. And patients are not to blame for their conditions, and clinicians are not solely responsible for their recovery. That was quite cool to be reminded of that. Sustainable practice requires realistic expectations, clear boundaries, and support from colleagues and multidisciplinary teams. The session also addressed practical strategies for managing workload. I think we all struggle with that, including the value of structure, effective communication, and recognizing that meaningful progress is often incremental rather than dramatic. Importantly, many patients are not seeking a quick fix. They want to be taken seriously, understood, and given reassurance about their symptoms. And a recurring theme was the importance of connection. The session concluded with a reminder that FND care is a team sport and that clinicians should make use of the wealth of expertise and support available within the wider FNDS community. I think that's so valuable for people who work in isolation often to reach out to colleagues from the FNDS community. So I really, really enjoyed that session.
I'm so glad that you mentioned that. I've been doing F&D work for about 4 years now, and there's something quite validating and helpful to see your heroes standing on stage, Alan Carson and John Stone, and telling us we have these challenges too. We face the same struggles. We have the same needs. It allows us not to feel in isolation when we hit those roadblocks.
I find it so telling, when John Stone gave that quote of that junior doctor who said it in his clinic, who said, the most the most helpful thing was seeing struggle. But I totally see where it's coming from. I can totally.
And the thing about time as well, that his clinics are always run late.
Yeah.
I was like,
you too. Oh my God.
like, okay, good, lovely.
I think a theme for me that day was definitely team, exactly as you said. And, the whole all the talks, my nurse and I were texting each other, planning our next team building activities and all the things we wanted to do together to really emphasize that.
And I love as well that there are like nurses here. Obviously we've such a wealth of sort of psychological experience and also neurology and psychiatry, but also like more nurses, more speech and language pathologists and therapists, and like, and kind of an obviously amazing OTs. And you know what I mean? It's starting to feel like we're actually getting the whole team sort of to come. So I've been texting my people being like, you all need to come next year to figure out how to get people study budgets. So
but you did see for a lot of teams, the whole team actually turned up, or certainly various team members. It was really nice to see, isn't it? Yeah.
And in our neurology track, we asked sort of the audience who was there, and we had a paramedic there, we had a family doctor. Like that was like very, very wonderful.
I sat on a table with a gastroenterologist.
No, this is it. Exactly.
It was also really nice to hear that moment when Professor Stone mentioned in a perfect world you'd have this huge multidisciplinary team, but that one person can make a difference. If you don't have the resources, if you're not in the location, in the setting where you have a big multidisciplinary team, you can make a difference.
Yeah. So didn't he say though that you can just even some of the best things he's done is just phoning somebody, having that conversation with a therapist who maybe doesn't feel so useful or doesn't feel like they have the skills. And I think as well, like FNDS, the training and the rehab 101, like that is again another thing I'm going to take away, because there are people sort of again that I work with at more the district general hospitals that feel very much like they don't know what to do. And I'm like, oh, I'm going to go to that resource we already have and, again, do that. Anyway, I'm sorry, we're talking too much about day one.
Yeah. I think everyone's comments about day one is just a testament to the importance of foundational training and entry-level access for people for where FND as a diagnosis and as a profession is. And so I think it's just so important that we highlight that you don't need to be an all-star in FND to come to FNDS and learn something and participate. So I think that's excellent. With that said, let's continue discussing comorbidities with Gabrielle and some of our first talks that we heard from.
Yeah, so I think we've had a really nice selection of talks that really highlight the comorbidities that we see with FND. So we've had some talks about, the GI system and the gut-brain axis. We've talked about POTS, pain, Ehlers-Danlos, so lots of different things. And that's something actually that we're really looking forward to as well in the next day with autism and migraine. Exactly. Yeah. I think something that really stuck out for me was the POTS talk. I really loved the description of POTS as being a functional autonomic disorder. And there are also structural autonomic disorders, and we can really think about the condition in a very similar way. And I loved the future of POTS treatment with using or borrowing from pain reprocessing therapy to POTS reprocessing therapy and starting to think about these novel treatment options. Very exciting.
Yeah, that feels very hopeful as well, I think, because and again, that sort of hope was similarly, I think, taken forward in the Ehlers-Danlos lecture as well, which again felt really hopeful and very much like, okay, so, we know that sort of 1 in 10 people will be asymptomatic, but will kind of have these positive findings in the Bite score. And I think we actually had to tell
the audience.
We had everybody to be quiet because everybody was so busy checking to see.
You can't see, but all the guests right now are doing the EDS different tests of hyperflexibility with all of our
more than 10 degrees is pretty good, but that's way better. Okay.
So the whole entire room of 600 people looking at their elbows and their thumbs, it is quite a spectacle.
To be quiet, like twice, because the talk, I think, was so engaging. And I think, again, it's been so nice to be in a room, I think, full of other people that are really enthused by all this stuff. Because, again, the conversations at the tables, we've had to at times be like, shh, stop it, everybody. We need to just focus. guys hold the prize up here. But I thought that was really good and really hopeful. And again, and again, I think some of the narrative about EDS is it can be sort of very like, oh, people are broken and their autonomic system is broken and they're going to end up with all these kind of awful things that are happening to them. And I thought like somebody who's just so clinically focused, and to have that talk and to have that sort of those positive outcomes, and to talk as well about like again treatment, I think it's the kind of thing I am going to say to you, like everybody listening, go look at that talk. It was really good. I think the POTS talk and that one were just like my real highlights.
Ingrid, I know you had firsthand experience having moderated a session. You mentioned how engaged everyone is. The other way that's been reflected is the number of amazing questions. We've got this cool app this year where people are able to put in live Q&A and the moderator fills it, and there's just not enough time to get through all the questions, but certainly points to how interested the audience is.
Yeah, they're exceptionally thoughtful. Very poignant. Great.
Yeah. And I think it's been really nice as well, again, so to have different kind of thoughts in the room as well. So we were talking about like at the beginning, you have to sort of, when you sign into the app and things like that, you have to agree that you're going to be comfortable with other people saying things you might not necessarily agree with, because the thing about FND is that they're I think particularly because it's been sort of something that's been so stigmatized and under recognized, you have a real sort of fellowship with people. And what that sometimes means as well is that you have to make sure that we're not just seeing what we want to see, that our predictions aren't becoming, too big a trajectory. So I think it was really helpful to hear a different sort of viewpoint with the pain talk. And I think that allowed us to sort of have a look at this. And again, I think that it was, it was really, but again, I thought that was really well handled where people, again, where we had that challenging but helpful discussion about, again, what is nociplastic pain, what is neuroplastic, what is nociceptive pain, what are the differences between those. And I think, again, it started a lot of conversations about some of these really important comorbidities. And as Gabriella said, we're looking at migraine, we're looking at autism, we're looking at these other kind of things that, again, we see over and over again in our patients. And it's just trying, again, what is the rest of the world saying about this, so that we're not just in our little bubble where we're like, everyone thinks this, you know what I mean? And then again, if we disagree, we can do that in a really lovely, respectful way. And then we can also, again, recognize that, other people have thought sensitively about these things. So how do we then, again, sort of assist in sort of maybe shifting conversations forward? So I thought it was a really positive thing. Again, you want all the voices in the room, and then everybody moves forward. And we had a really interesting conversation about the sort of the functional gut disorder stuff. And I don't know if anyone else wants to say anything about that.
Well, I think that does tie in pretty well into some of the upstream mechanisms that we've been learning about today. This idea of the embodied mind. So when we think about functional neurological disorder, the concept of our brain is trying to make its best guess about what's happening in the body, how to interpret and perceive the signals it receives from our body. And sometimes its best guess might not be exactly accurate. And it could even feel extremely confident. It could feel quite certain that it's accurate, even when it's not. And we have applied this model, this predictive processing model in FND. But as we start to learn about these conditions, like disorders of gut-brain interaction, like POTS, like chronic pain, we see that this is a common story that runs across disciplines. We've been talking about some of the same things, just using specialty-specific language. So one of the nice things about FND Society, and as I heard my colleagues say, that there was a family medicine doctor, a paramedic, a gastroenterologist, that's exactly what we need to shed light on how these conditions might have a common cause, a thread that's upstream happening in the nervous system that could explain symptoms across different organ systems. So it's been really, really impressive to see that play out. But there's a lot of science that's happening in interoception and predictive processing. There's a lot more that's coming down the pipeline. And then, of course, the pursuit of knowledge is great. On its own, fantastic, wonderful discovery, 2 thumbs up. What's really wonderful is when you can apply the pursuit of knowledge to ease the suffering of another human being. And that is the intersection of the FND Society. I want to put a plug in for, on that note, this is the first year that we're launching our Cultural Ambassador Program. And we are over over the moon excited about this because it has brought together over 20 ambassadors from around the world to come together to understand how culture informs the diagnosis, the treatment of people living with FND, and how do we continue to share knowledge across languages, across regions throughout the world. So it's really beautiful to see that coming to fruition.
I think it's so positive. And actually, and I know Charisma will hate me pointing at her, which I'm currently doing. but Charisma's talk was also about her explanations, how they have to be sort of cultural specific. And again, I think that's, you know, even the language that we use, the analogies that we have, they are going to be different depending on where we are and what our, you know, and so again, as you said, like I'm so delighted as well about the cultural ambassador. I saw the role and I was immediately like, go everybody go, because we need to have an understanding and we need to be able to speak with local parlance about what this is, because it is a universal thing. You know, this is what happens when the brain predicts wrong, isn't it? Yeah, so I really like that. And I also liked in the functional gut disorder bit where the speaker talked about how overlap is the rule, not the exception. Mm-hmm. She was like, look, if you've got IBS, you're probably also going to have these other things. And I think, you know, again, like looking at all this stuff, if you look way back at one of my heroes, Daniel Claw, who Erica did a lovely podcast with, you know, again, he was talking about that way back when. And again, I think it's just so nice to sort of see these things replicated, and again, in a really scientific way. Right. Yeah, and the interception talk was such a scientific exploration of that. So I don't know if it's, I mean, that was amazing.
That segue into just how there is no simplicity in FND. It's always complexity. I think that's a great segue into discussing the upcoming talks and the rest of the conference, where we have discussions considering autism, migraines, autoimmune, and classification. Speaking of how we're even attempting to classify all these different overlaps and conditions. Does anyone want to share any hopes, expectations, and comments about our classification?
Am I allowed to just say that Sonia did the first talk I've ever heard about classifications that wasn't boring? I was gonna be like,
that is an art. That is an art.
I was not asleep for any of that, and that is really difficult. So I think, but it's so exciting, isn't it?
It is. And I think something that I'm so excited for about it is really, you know, as we're thinking about all these different conditions that probably have similar upstream mechanisms, we're starting to define a little bit more what is FND and how is FND different, but also related to these comorbidities and these other things. And I think that is very exciting for me in terms of what that can mean for future research for our patients.
And it makes clinical sense.
Exactly.
Like DSM by all means has come a long way, but it's very much historically grown and has some historical baggage as well. And seeing on the basis of the new understanding we have, those very sensible classifications, I think, will do a lot of good to the society and for patients. And
for those listeners not aware or not following along with the conference, as an FNDS initiative, there is a classification committee and discussion, and Sonia presented those prutiliminary steps or components and requested membership feedback, which again, just the cutting edge.
Raise your voice, everybody. Yeah, raise your voice.
We will try to include a QR code in the show notes. That may or may not be possible. But if you are a member, we would encourage, we will also send it out and highlight that in the upcoming newsletter, et cetera. So please do comment and make sure that your views are represented so that we have a well thought out diagnostic classification system.
Yeah. And a shout out to Charisma, who was on the working group for, I believe, the functional dissociative seizure subgroup. Yes.
Yeah, and the hopefulness of the conference has been a big thing, hasn't it? We had the functional cognitive disorder sessions this morning, which were again about diagnosis and all of that work. And again, you know that thing about is, you know, I think again this there's been several you know, kind of commonalities. So everybody's had biological, psychological, social, great. Everybody's had don't be weird. But then also people have really again embraced other literature and brought that in. So again, a lot of like Noah Silverberg's work about kind of post-mild brain injury stuff and the functional cognitive disorder stuff, and then also all this hopeful kind of rehab stuff that I know that you're leading on, Erica. And again, she's already gone red because she doesn't like it. She's fabulous. But I'm sorry, you give a great talk. We need to talk about it. But it was really, really positive. And again, I think just and it's something is that maybe if you don't mind, we could also share your QR code too in terms of
for access to the functional cognitive resources. Yeah, of course. I'd be very happy to share that. Yeah, thank you. Assuming we can include it. I don't know if we've included a QR code in the show notes, but
or a link.
Yeah, we can do that as well.
I think one other thing I'm looking forward to is the patient session.
Yeah.
So including the perspectives of our patients and to just keep us reminding that they are at the center of our work and also to learn from them. So, yeah.
Oh, that
To add that. Yeah, that's it.
I think it makes it much more poignant, doesn't it, to have, because we've got patients in the audience, and it just it's that thing, isn't it, about when you have people that are involved in the care that you provide in the audience. You that's exactly what you want, because you want to know what are the questions that they have that we are currently not answering. What are the things that are coming up for them whenever they're listening to us present, and that is.
And how nice to connect to them. I have several patients grabbing me between sessions and having a chat and connecting. And it's, really, where else? What other society do you imagine that?
That's something very special.
What a privilege, isn't it?
I think it is. It offers that different layer because we're all here because we're clinicians, but the opportunity we have with patients is one-to-one, and there's not really a forum for the broad patient to talk to the broad clinician about the state of the field, which is just the level at which that can impact change or guidance or growth and shared growth and learning, I think is really powerful and very impactful.
I know we're probably running almost out of time.
Oh, we have talks to get to.
I know. I'm all so I'm going to give you my top talk. Okay, right? So I really liked when bodily self is no longer functional. Love that. So I'm a normal. I'm just a boring clinician that sees patients, but like that was my favorite one. Like, how interception works and how it's lovely. Yeah. And that was my favorite. Okay, what about anybody else? I'm on the spot.
I give a plug for the driving talk. Alex will not say it himself, but just patient safety with driving. I can't think of a more critical clinical intersection than that. And I think they've done great work. That was one of my favorites.
I think my favorite was Ingrid's talk about women and hormones. And, when I was moderating the session this morning, seeing the number of questions coming through about menses, about menopause, I think it struck got some people thinking, shall we say.
And she could totally have a second career as a stand-up comedian.
I would like to point out that I gave everybody $20 before we came in here. There you go. So right, lads, if you just say how gorgeous I am, I will.
I'm just waiting for Ingrid's Netflix special.
No, you know what it is? I had Hulk Hogan in that, and I was like, I'm done now. That's it. Half an hour here.
So
anyway.
You've heard it. Just FNDS is Hulk Hogan. No, it is a wonderful place, I think, for providers to connect and have each other as a resource, as support, to learn from each other, to hear from patients, and to try and progress the field at all different stages across people just starting to great research to clinicians just trying to learn and improve and practice. And it's just, I can't say, I don't know about you guys, but I just think it's always such a pleasure to be so inspiring to see so many wonderful people, and just good for the soul to see other people who are as crazy about the conditions we are, a little crazy and nerdy. So with that, I want to be sure to thank everyone, and please enjoy the rest of the conference. And thanks to all of our listeners.
And we'll see Prague. And
Prague. Okay, bye everyone.
Bye.